Jana, tell me about Arkeo that you're the Chief Executive of.
Arkeo empowers individuals and organisations to take control of their mental fitness through a tracking system that I built 3 years ago. I used it to collect data on myself to make decisions so I could recover from a severe depressive episode, and I've turned that into an app.
And tell us more about the app. How does it work?
So the app itself works based on the premise that it takes into consideration data that you're inputting about your lifestyle choices. So your food, your mood, your sleep, your exercise, caffeine, alcohol, nicotine intake. And then you can also track up to 5 what we call low mental fitness symptoms, which are both diagnosing and non-diagnosing words. So anything from irritability to anxiety, to paranoia, to depression. And what our app does is it's really clever, and it uses all the data, and it will highlight your patterns and trends and show you exactly what you're doing and how that's impacting you based on your inputs, as opposed to saying, well, this is what ready available science says, you should get 8 hours sleep. Actually, if 6 hours sleep or 7.5 hours sleep works really well for you, then the app will highlight that and let you know.
And does the app have the ability to collect information that's already on your smartphone? So, for example, Apple collects my sleep data and my blood pressure data. Does that get fed into your app?
So right now we're not currently pulling in from wearables yet, but we will be as of the beginning of next year. We're really early stage. I just received seed investment. We're launching version 1 on the 1st of October. And then as soon as we can implement pulling in from wearables, we will be, yeah.
And do you consider your app to be likely to become a medical device?
No, we specifically stay away from any kind of, we're not a diagnosing tool, we're not a treatment tool, we're a tracking and performance-based tool. The way I see things is that the world has a lot of data on us. There's lots of organisations out there that have data on us. They learn about our patterns, our behaviours, so they can sell us things or provide things that will be useful to us. But we actually don't really understand ourselves how everyday choices that we are making in our lives impact our ability to manage our lives. So my main focus was to provide a tool that everyone has access to. That means that they can just check in and see their behaviours and their patterns and whether they're having a positive or negative impact on their life.
And what is your future vision for Arkeo?
So we've got quite a big vision. Right now we are already talking about turning the app into Chinese and simplified Chinese, talking about going into different markets around the world. My main aim is by 2050 to have 1 billion people on this planet tracking their mental fitness in the same way they do their physical fitness. I'm really focused on actually changing the way society thinks about taking care of themselves, to incorporate looking at your mental fitness and your daily actions and how that impacts it. And we're also really focused on creating a brand and something that people can move into and follow and become part of a movement of basically changing the way we think about taking care of ourselves.